Promising news today from drug maker AstraZeneca. The company is saying a trial proves its COVID vaccine is 79% effective overall in the U.S. and 100% effective against severe disease and hospitalization. AstraZeneca also says an independent board found no increased risk of blood clots from its vaccine, amid shaken confidence in Europe after a dozen countries halted use due to a small percentage of recipients reporting blood clots, though no link has been proven. The news of a potential fourth vaccine also comes amid a recent rise in COVID cases here in the U.S. Experts are warning of the continued need for as many vaccinations as possible, with Trump's own vaccine chief cautioning about the political drive behind much of the vaccine hesitancy.
I'm very concerned that for political motivation, people decide to actually place themselves and the people around them in harm's way by refusing to be vaccinated. I think we need to do every effort we can to explain to people that vaccines have nothing to do with politics.
Joining us now, MSNBC medical contributor and global health policy expert, Dr. Vin Gupta. Dr. Gupta, what numbers can we feel good about? I mean, 25% of the population being vaccinated or at least having a first dose seems like a very good development. 54,000 new cases a day seems like a very bad development. At what point does the seesaw balance out? Where do you want to see those new case numbers for all of us to feel good about where we are as a country?
Well, Alex, good afternoon. Good to see you. I would say so there's a few numbers that are really promising. Let me start with AstraZeneca and say that the number that I wish media outlets like the New York Times and others that get well read would reference is not 79% effectiveness for the AstraZeneca vaccine, but it's 100% effectiveness in reducing and completely preventing hospitalizations and deaths amongst those individuals in their phase 3 trial that received that vaccine. Same as Johnson & Johnson, same as Pfizer and Moderna. That is the only message that matters. And Alex, the reason why here is we're seeing both surveys, both stateside and then across the world, suggesting a lack of trust and motives regarding the vaccine, obviously a lack of trust in our institutions. We need to be crystal clear to people about what these vaccines do and what they do really well. And that's keeping it out of the hospital to the tune of 100%. So we can hang our hat there. The other issue to your question about cases and what level of cases should we be reassured by? Right now, 54,000 cases a day is not good because we have only 20% of the population vaccinated, protected from the hospital. That number is going to matter less and less as we get more people vaccinated. And we're going to start defining herd immunity, not by number of cases in the community, but by deaths and hospitalizations. That's what's going to matter, because we know that these vaccines will keep you out of the hospital, but they may not reduce case transmission. So come July 1st, it's going to be about what hospitalizations and deaths look like nationwide in every zip code, not necessarily a number of cases.
That's a really important distinction. I want to talk about the vaccine hesitancy. The AstraZeneca, I will call it a controversy in Europe, though the EU medical board seems to want to put that controversy aside. When you talk about the concerns people have in the United States that exist outside of politics, do you think the narrative that built up in AstraZeneca in Europe, do you think that has a potential to turn people off of what is potentially a life-saving choice, which is to get vaccinated here in the United States?
Absolutely, it does. I mean, if I didn't live and breathe this every day, it would probably cause me to think twice about it, too. And so this narrative that has been built up has been incredibly damaging, that somehow this vaccine causes blood clots, when in reality, blood clots are unfrequently a fairly common adverse medical complication that occurs in the general population. The incidence rate of blood clots amongst those who had received the AstraZeneca vaccine was far lower than that. But we were drawing these correlations. Countries, in my view, acted too quickly, and there was a regulatory pause that revealed no direct correlation between the vaccine and the blood clot. But yes, this has shaken confidence, no question about it, which is why we need to be doubly clear with people about what these vaccines do extremely well. AstraZeneca, Alex, is vital to end this pandemic because it's one of the most accessible vaccines through the WHO's COVAX facility. It's what's going to help get the world vaccinated. And we need the world to get vaccinated to end this pandemic. And so if there's shaken confidence, and surveys after surveys suggest there is, we need to double down on better communication here. And so for all your viewers out there, all once AstraZeneca gets approved in the United States, the 3 currently approved vaccines plus AstraZeneca, to the tune of 100% will keep you out of the hospital and certainly keep you away from the intensive care unit, people like me, and you will avoid death if you get a vaccine. That's all that matters.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.